Hey, it's Chris Byer.
Hey, Chris Bowling. How are you, CB?
Good morning. Good morning. So we are still in month of May, Mental Health Awareness Month. I had a topic today we wanted to share, focus more on the financial side of the health plan, probably for the CFO, CEO. Is trying to figure out how they control costs, but also take care of their employees.
We have seen, obviously, through COVID, but even now, here are
Yeah,
we, what, 3 years outside of COVID, and the claims on mental health just basically continue to get worse.
yeah, yeah,
There's no improvement. Um, the sad thing is we're blowing through those free EAP sessions real quick, and then they're hitting the health
yeah,
plan. We've had some really, really bad claims. So, yeah, I
yeah,
think starting last year, you and I had to start digging in deeper. Yep, of course you can get it through your life vendor, LTD vendor, the
yeah,
the free, but it's just, man, that just doesn't seem like it's working anymore.
yeah. Well, I know, just within our geographic area, we've said this before, access to mental health care through an EAP, it might be covered, but it's hard to get the appointment.
Yeah.
So I know we've looked at, again, as you think about the financial side of it, look at your claims, identify what's happening. We've seen some inpatient care for mental health. We've seen a lot of unchecked mental health to where
Yep.
somebody's on a medication, but yet they're not regularly seeing a physician. So we've looked at quite a few different programs that are not the free thing, but that can target those specific conditions and provide support to employees. The challenge that we're running into is how much does the employer want to invest for the goodwill of their employees versus the results of the claims. Because there's some great mental health apps, there's some really good counseling programs that can come on site, but at the same time, are people going to use it? I think that's still the challenge. Is somebody going to properly take care of their mental health like they need to? And I don't know that we have an answer for that yet.
No, we certainly can't put an ROI to it yet. I mean, my
No.
gosh, if you think wellness is hard to prove on an ROI, try
Yeah,
this because
absolutely.
all right, well, did that person automatically go to that point solution?
Yeah,
Did they skip EAP? So we really don't
yeah,
know yet. I mean, what's hard is many of these of our HR professionals tell us, I have a employee in my office desperately needs help today, and the soonest I can get him in somewhere or her in somewhere is 6 weeks from now.
yeah, yeah. And that is the biggest challenge, I think. We've seen also some employers that have bought up an EAP. They bought an independent EAP. Unfortunately, we've seen,
Yeah.
an employee pass away on the job. And then, everyone's dealing with that crisis. And some of those buy up EAPs, the independent ones, they'll send out a crisis team to do on-site counseling. But again, that's hitting a specific crisis situation. The challenge, I think, is still somebody that needs access to mental health care today.
Yep.
It's going to likely hit the health plan at a much higher cost unless there's something that can be that interim in between and be quick access. And I know we've got clients that say, I don't think my employees would use the app. We've got clients that say my employees would love the app. I think you just got to figure out what works best for your culture and then trust that you're doing better for your employees because you and I looked at a quote for a mental health app program. It was less than a health plan spec deductible for the year
Yep.
and they've already had a mental health condition that's blown through a spec deductible because that member needed inpatient care. So I don't know. I think it's more to come, but just know that from the financial side, there's more opportunities to look at things beyond the EAP and maybe beyond this.
Yeah, I agree. Well, this isn't going away and you can't ignore
No,
it. So
no,
either you get
that's
ahead
very
of it,
true.
start doing your research. It's so simple to ask for some claim reports for 2 to 3 years. Just say, I want it broken out, inpatient, outpatient. What are we spending
Yep,
as an organization? Compare that to whatever these quotes are going to look like. And,
yep, absolutely.
and as you said, maybe you're just doing it as a goodwill. Maybe it's not around ROA. It's just as simple as I want
Yeah,
to make sure that my employees can get access when they need access, and I don't have confidence in the system we have, currently today. It's that
yeah,
simple.
that's well said. Thanks,
Sweet.
CB. Good to see
Thanks
you.
for sharing, buddy. We'll see you.
All right.